This is Frequently Asked Questions about Natural Migraine Relief, Episode 21, Ginger Root as Migraine Therapy. Hi there, this is Jeff Baker, your physician host for FAQs about natural migraine relief. Historically, ginger root has long been used as a home remedy for migraine headaches. In this episode, I'd like to review how and why ginger could help and how to use it as acute therapy for a migraine headache. When we think about how any potential remedy could help a health problem like migraine headaches, it is helpful to consider that the management of any health problem like migraine requires the identification and management or removal of the individual specific root cause factors that cause the problem. Because ginger has been found to reduce both pain and nausea, it has been studied in the context of migraine headaches. Results have varied from no benefit to pain-free 2 hours after treatment. On the anecdotal side, I've had patients report to me that their at-home use of ginger when they sensed an approaching migraine minimized or blocked their headache pain and associated symptoms. In a 2013 study of 100 patients, researchers found that taking a half teaspoon of ginger in a little warm water at the onset of a migraine attack could be statistically comparable to sumatriptan, which is a commonly prescribed migraine abortive medication. As ginger has far fewer side effects than sumatriptan and is considerably less expensive, it may be worth trying to see how it works for you. Some of the root cause factors that ginger may affect include increasing the levels of serotonin, which acts as a chemical messenger during migraine attacks. Increasing serotonin can help migraines by reducing inflammation and constricting blood vessels. Another would be the inhibition of excess prostaglandins. Excess prostaglandin enzymes have been associated with painful menstruation, osteoarthritis, and migraines. And also by downregulating overactive white blood cell neutrophils, which are hyperactive in several autoimmune diseases, which may be perpetuating ongoing inflammation. Inflammation in general is one of the more important migraine root cause factors we should always seek to address. Because ginger has multiple active chemical constituents, it's not yet clear which of them plays the greatest role in helping to relieve migraine. We also have to consider that the chemical constituents of ginger will vary depending on the source and extraction method. These factors, along with your specific individual root cause factors for migraine, will determine the potential benefit of ginger therapy for you. Having given you that general disclaimer, let's get down to details on how you might use ginger to manage a migraine. First off, while some may use daily ginger to prevent migraines, it is more commonly used at the onset to manage the acute event. And that is what we'll be reviewing. Here are some of the more commonly used ginger strategies. One of the more common recipes is to stir a quarter or half teaspoon of ground ginger directly into 6 to 8 ounces of water and drink it as a ginger juice. You might find it easier to mix in 8 ounces of bottled water. First, pour off an ounce or two, put the ginger in, cap the bottle, and shake it well. You can also make it into a hot tea using the same recipe. Number two, you can also take ginger in capsules, where the equivalent dose is 1 to 2 caps taken when you first note pre-headache aura symptoms or at the onset of pain. You can repeat the dose in 2 hours if needed. Look for this in the 550 milligram capsule size, and it's probably best to get the full spectrum root extract, as we're not always sure which combination of ginger ingredients gives the best benefit. You can generally buy 100 capsules in the $4 to $8 price range. If it works, that sure beats the full retail sumatriptan cost of $10 a pill, although through insurance, most prescriptions are now less than that. Number three, you can also use ginger as an essential oil, applying it directly to your temple area. You can add it also to a warm bath or a steam diffuser, although the benefit of this is more for nausea than headache pain management in general. And number four, use ginger in a lozenge as an option if you don't want to drink ginger tea or prefer not to use essential oils. The lozenges are generally more helpful for nausea than for pain. If you want to give ginger a try for migraine management, you may need some trial and error to see, number one, does this work for me? And two, what source, what dose, and which of the four methods described above works best for you. I found that a little bit of trial and error is usually necessary, but if you can find one that really does hit the spot for you, it could be well worth the effort. Ginger is only one of the 90 non-drug therapy options I found useful for migraine headaches. If you would like to understand the broader range of root cause factors that drive your migraine and then individualize the many possible therapy options, you should take a look at my comprehensive Natural Migraine Relief for Women course and its unique migraine action plan system. See naturalmigrainerelief.online for more details.